So, all right, we have 3 patients around here. So let's go through all the 3 patients and what I find you guys need to work on a little bit, okay?
Okay.
And so actually the first one is that patient, I've seen her many times. She is a acupuncture program student here as well, okay?
Uh-huh.
What she have is some bloating and some yin deficiency of the stomach, and for her heart as well. She have insomnia issue, hard to fall asleep, easy to wake up, and she also have some palpitation. Whenever she getting nervous, stress or something, she have a severe palpitation, and she sweats a lot. Okay, she sweats a lot, and whenever walk a little bit, and she will sweat like all over her body. Okay, yeah. So what causing that in TCM?
It's usually qi deficiency on the surface.
Qi deficiency, yes, all right.
Yeah.
So qi deficiency of which few organs will causing sweat like that
Maybe
easily?
lung. First would be lung. Right?
Well, actually, lung not necessarily connected to the sweating the most. When people have a qi deficiency of the lung, first they will feel they cannot breathe deep enough, and they breathe very shallow, and they talk very fast, and you feel the gap in between their sentence. That's the first sign. So when they have sweat a lot, so actually it's a qi deficiency of the heart and one more organ. No, yeah, spleen, yes. So when they have a spleen qi deficiency or heart qi deficiency, especially heart qi deficiency, they will tend to sweat a lot. Okay, so checking their the heart region, heart pulse. Okay, making sure you do not rule that out. So you need to, for that patient, we need to tonify the heart qi, heart yin, and also tonify the yin of the stomach as well. And she actually mentioned something very interesting. She feel kind of a bloating of her stomach before eating a meal. After eating a meal, the bloating actually getting better. So what causing this? Why after eating, her bloating actually is getting better? So what's the difference?
Does she have some kind of excess in the stomach so that once she starts eating food, then you're
Well-
using the qi and now it's better?
Well, eating more food will causing more excess, right? So excess of what? Of qi there, you think, right?
Right.
So eating more food will solve the qi stagnation there?
Because you're using qi to digest the food.
Where is the qi stagnation at the very first place? You think it's at the stomach, right?
Yeah.
When you're leading more food into the stomach,
Uh-huh.
that solve the qi stagnation there, or it will bring more qi over there to dissolve the food. This is very common issue. People are always telling you, before eating something, I feel the discomfort of my stomach. After I eat something, drink something, my discomfort of my stomach settle down a little bit. So what is the issue here in TCM? Actually, it's the yin deficiency of the stomach. Do you notice like there is some like unsettled, noisy sensation from the stomach when there's a stomach yin deficiency? Have you guys learned this from the diagnosis? So this to her is kind of a bloating sensation. However, it's not fully bloating because there is no food inside, right? So this is kind of a yin deficiency of the stomach causing this sensation. Okay, that's why we have to tonify her like a stomach yin as well. And so I asked one of your students, so what is the best formula to targeting that? So what do you think is the best formula to targeting that case?
He's like Maimendong. Maimendong.
Maimendong, yeah. What's the ingredients inside?
Maimendong. I think Tianmendong is in there, right?
Yes.
Is it Yuzhu in it? Is it Yuzhu? Yuzhu.
I forgot the ingredients, to be honest, yeah. Look it up.
Okay.
Yeah.
I just know Yuzhu also helps stomach yin. I just know Maimendong and Tianmendong is in there. Maimendong, Renshen, Gengmi, Dazao, Gancao, Nanxia.
Okay, good. All right. So this one works, however, under one condition. So actually, the classmates recommend Gui Pi Tang. Gui Pi Tang is very good to nourish the qi deficiency of the spleen and tonify the blood a little bit, right? Yes. Do you think Gui Pi Tang works, or Maimendong Tang will be a better option?
Wait, so she has stomach indeficiency,
Yeah.
bloating,
Yeah.
and she what?
Palpitation.
Palpitation. Oh, and she also sweating.
Sweating. Yes.
Palpitation, maybe Guipitang is better. It's
Oh,
better.
yeah.
Guipitang can tonify
Yeah.
the
So yeah, actually both 慢门浓汤and 龟比汤 work towards the direction because there's a certain level of qi deficiency, yin deficiency over there. So 慢门浓汤 can working for the qi deficiency and yin deficiency in general as well because there's a 人参, there's a 精米, there's like 慢门浓, 天门浓 can tonify both the qi and the yin, right?
Yeah.
However, my argument is people have a bloating issue, people have a stomach issue. So whenever you using those formulas, they are very rich. You have to be careful. They can digest this formula or not.
Right.
Giving a lot of very very heavy formulas for some of my stomach issue patients. Their feedback is for some people they can tolerate. For some other people, making the issue actually a little bit worse. So you have to think: can their spleen stomach tolerate this rich for nutrition or not? Right. So what my approach. I'm talking about the second one, herbal approach. What I'm approach for the stomach issue patients. So I will making sure adding something to move the stomach and the spleen, making sure their stomach spleen move fast enough to dissolve all the formulas, right? So if there's some single herbs you can add or some simple formula you can add, to increase the digestion system overall. Is there? Chen pi, okay. Chen pi actually reduce the dampness, reduce the phlegm more, right? However, Chen pi good, however not strong enough to move the qi. Yes, Sha Ren is a fabulous one. Sha Ren is circulating the qi of the middle jiao, right? Sha Ren is the best solution. Is there any other things you can combine with the Sha Ren? Mu xiang. Mu xiang Sha Ren is a very good one. So usually, Mu xiang Sha Ren is my go-to solution when I think their stomach is not strong enough to tolerate my formula. Adding these two ingredients. So do you still remember 香砂六君子? 香砂六君子 is 六君子汤 plus 木香 and Sha Ren. Because why they adding 木香 and Sha Ren? Because 香砂六君子 that one reduce dampness, reduce the phlegm, tonify the spleen qi. However, they cannot tolerate the whole formula. They adding 木香 and Sha Ren to circulate everything for the middle jiao, right? So in the future, when you think their stomach is not good, adding 木香 Sha Ren, okay? Yes. And one more thing I have to share with you guys is beside 木香 Sha Ren, sometimes there's a qi or yang deficiency of the spleen or stomach. Sometimes I using 焦三仙 as well. 焦三仙 is a very good small formula. You familiar with the 焦三仙, right?
No, I don't.
焦三仙 is山楂、神曲、麦芽。山楂、神曲、麦芽 they are all to digest the food. Food stagnation, yes. However, you fried all those three ingredients to kind of black color, so kind of towards 焦, towards
焦三仙,
yes. So we call this 焦三仙. 三仙 is a three god, three god, working for the middle jiao, So I adding 焦三仙 and sometimes 木香 Sha Ren when I think their qi or yang is okay, just circulating the qi, So this is my herbal approach, okay? This is something I want to talk about. And for the first one, diagnosis approach. So in the future, you guys are going to open your own clinic and have your own patients, right? So I noticed something you really have to pay closer attention, which is share your whole diagnosis with the patient and share your whole treatment plan with the patient. So sometimes patient come in for different issues, but that is only the chief complaint of the patient, right? They always have other issues beside the chief complaint. So what I recommend you guys is for better business and better outcome of the patient and for your better practice, you better to share the full diagnosis of the patient, especially for the first initial visit, right? So making a list. So according to my diagnosis, you have such 3 issues. I know you only come here for the first one. So after we resolve the first one within the first 2 or 3 sessions, for the following sessions, we better to looking after the second one, the third one, right? So the patient know what's going on for their own body. They will come back more often, and you getting more like a business, and the patient getting more like a better treatment, aiming for better condition of their physical body, right? So I think this is a win-win scenario. So you're making sure when you share the information with the patient, don't think, oh yeah, shoulder issue, just treating the shoulder, and share the whole story with the patient. Okay, this is a very good a business tip. Okay. Yes. All right. Yeah. So this is the first point around here. Okay. Yes. And for Francis, this is what I want to the third point I want to mention, the warm up. Yes. So for that patient, her chief complaint there are two. One is high blood pressure, one is eczema, right? Yes. So when you
last time.
Me?
Yeah, Francis, the lady have the eczema.
Oh yeah.
You remember, right?
The one with the dog. She carries the dog. Yeah.
Oh yeah, I don't know the dog or not yet, but you remember the eczema condition
yeah.
of her shoulder, right?
Yeah.
Yes. So for those type of patients, in the future, especially at Vancouver, you will notice a lot of people have a dampness retention cases due to the weather conditions right here. Dampness retention is a very common condition. So for those type of patients, so without warm up before the needles, I don't think the needle will help that much. So what is dampness? Dampness is bad fluid stuck in their body. They consider as yin pathogenic factors, right? So the dampness will slow down qi and blood flow to the maximum level. So that is why today, when May doing a lot of warm up for Francis, however, not so much like a gua sha acupressure marks showing. Even she using a lot of her force. For normal people, red mark showing already.
Yeah.
But for dampness retention cases, not so much like a pinkish showing around there. That means not enough qi and blood accumulate over there even after some warm up. Okay, so you imagine you try some needles without any warm up. So I do not expect too much qi and blood will travel to that region to do the actual healing job, right? So in the future, when you're treating any dampness retention patients, making sure you accumulate a lot of qi and blood before you put in the needle. If you do not do the warm up, just doing the needle insertion, I don't think the qi sensation and the result will be that obvious, just by applying the needle alone. Okay, so warm up is the key here. In the future, when we're meeting other cases, I'll share more. But for dampness alone, you're making sure you're doing some acupressure, some gua sha, some cupping to circulate some of the qi of the blood first. Okay, that's one. Two is during the needle insertion, dampness considered yin pathogenic factors. So you making sure the temperature here is kind of warm enough for the body. If the room temperature is like this, I don't think the result will be good. Okay, sometimes you put the patient in the room temperature like this for half hour, everything getting worse. Even you putting a lot of needle. The more needle you put in, the worse, because the needle can circulate everything, circulate the qi, while making the body temperature even lower. So making sure you raise up the temperature all the time during the whole session around here. Okay, so in the future for your own clinics, making sure you have actual blankets, actual TDP lamp. When you buy the TDP lamp, do not buy the single headed one, buy the dual headed one, buy the two headed one. Okay, much easier that way. You can just making everything cover the head, cover the lower body as well. Okay, I also using some heat bag for those, and the result will be showing phenomenal when you care enough. Okay, all right. So this is the third point about the warming up. Okay, yes. So about hello, yes, hello, Grace. Yeah. So for the treatment plan, number 4, we mentioned a little bit already. Yes, all right. So about the first point, diagnosis approach. We are talking about the third patient here. The third patient here come here for what is her chief complaint?
Pain, soreness in the neck and shoulders.
Yes.
And she feels weakness on her left side and imbalance, lack of balance because of scoliosis.
Yes. Yes. So this is what I'm talking about, the whole diagnosis approach. So as an acupuncture, as a TCM practitioner, or in the future you might go for the doctor program. So what we have here is quite limited. We cannot using like an MRI or X-rays, right? We cannot using any biomedical treatment to treat our patients. So TCM, herbs and needles, that is the only approach we can targeting the patients, right? Making sure our diagnosis is towards the TCM field as well, because this is the only way we can help our patients around here. And our diagnosis have to be full picture and precise as well. So I really recommend you guys have one or two like a complete full version of diagnosis, no matter from the pulse or from the tongue or from asking, making sure you are very good at the one or multiple diagnosis system. Otherwise, you don't know where the issue come from. So imagine if today you do not look at the tongue over there and you think, oh, this is like a shoulder issue. So I will imagine for 80% of the acupuncturists were targeting the shoulder alone without treating the spine over there, right?
Yeah,
yes.
yeah.
So for Francis' cases, if you do not checking the tongue, if you do not have the full picture, I think maybe for the eczema, maybe you are just targeting the eczema alone, and for the high blood pressure, maybe you are just find some random point targeting the high blood pressure without look at the root of the issues, right? So the real diagnosis system is looking for the root, and I think it's very important. It's our number one step. Be a TCM practitioner, okay? So I highly recommend tongue diagnosis in the future for you guys to learn, and pulse diagnosis, which is very good. However, at the very beginning, you don't have many patients to practice on, and pulse diagnosis, you cannot see the picture and record the information vividly compared to the tongue diagnosis, right? So I recommend you start either with the tongue diagnosis or the palm diagnosis. However, the palm diagnosis is very good, but it's very complicated. There's different theories about it. And when you check in patient's palm, patient have a misunderstanding towards it, because the fortune teller checking the palm, right? Yeah, so they might have some different wrong idea about your treatment. So which means the tongue diagnosis is easy to learn, and it's very handy for us to using this approach. Okay, yes. So this is what I want to share about the diagnosis approach. Okay, all right, yeah. So any question for those three patients or these 4 points? Oh, by the way, did you try the liver? You tried the liver aids, right?
Yeah.
Did you take a photo for?
I didn't take a photo.
That's okay. Next time,
Great.
Yeah, when we're taking the photo, so you will notice the shape change. Yes.
Yeah.
So one more very good thing about the tongue diagnosis is when you do the right treatment, actually you notice the color change, the coating change, the shape of the tongue change very fast, within 40-50 minutes. Even like before the session, after the session, when you do the right treatment, so actually you compare the tongue, you notice the difference as well. So the patient will have more trust in you. When you let the patient to come the next time, patient will do so more likely. If you do not have any result, you ask the patient to come back the next time, usually the patient don't trust you because you don't have any result yet, right? Yeah.
Right.
So this is another very good point about the tongue diagnosis. Okay.
Okay.
So any question regard those issues?
Yeah. Okay. So I've seen Francis maybe 3 times in the past 6 months. How would you treat her eczema on her shoulder?
So diagnosis is everything here.
Okay.
So yeah, we actually can have the diagnosis for the symptom alone, and we have a diagnosis for the root cause for the eczema, right? So for the symptom of the eczema, what is the TCM diagnosis for the eczema alone?
It's just like
over
damp,
here.
kind of wind damp.
Yeah, wind damp. But I fully agree. But you're missing one important. Yes,
Yeah, wind
heat.
damp. Yeah.
Because when you see the color there,
It's red.
what is the color? It's red, pinkish,
Not
red.
red,
Yes.
no heat.
Yeah, so whenever
Some people is not red.
some people is not red. However, for her it's red, right?
Yeah.
So red is the key information here. So damp and have to be there's heat. Okay. So my question is, what causing damp? What causing heat for that part? What causing damp?
In the
What causing
shoulder,
heat?
like in here
Yeah,
specifically.
there. Yes.
I mean, it could be weather, and then otherwise it would be diet. And
Diet. Yes.
Diet would be for
in
one
PCM.
example.
PCM. Give me PCM diagnosis.
what
PCM
do you-
patterns.
of why it'd be wind damp heat.
Wind
What
damp
is that?
heat. Yeah, I mean that is wind damp heat for
Yeah.
sure. My question is, what causing those wind damp heat?
Oh, I
Why
see,
is
I see.
not here? Why is not here? Why is only here?
Why is it only in the shoulder?
Yeah,
oh, it's in the
why is
gallbladder
that?
channel.
Maybe gallbladder channel.
Yeah.
But to be specific, what happened to the gallbladder channel?
Well, gallbladder usually can have damp heat in gallbladder.
Yeah, but
Right.
why is around here? Gallbladder is from here all the way to the toes.
Right.
Why is only here? Very simple answer. Don't make everything complicated.
Oh, it's just
very
like
simple.
weather?
Yes.
It's the
Not
weather.
weather. Yeah.
Attacks
There's
the
some
upper
definition.
first, right?
No,
Wind.
why not this side? Why not only like a showing only on one side?
There's
Oh.
stagnation there.
Yeah, stagnation.
Yeah, yeah.
What causing? My question is, what causing this stagnation?
Circulation.
Circulation.
circulation,
Yes,
perfect.
I'm looking for the key points. Yeah, you keep missing the key points. Qi stagnation.
Oh,
Okay,
okay.
this is I'm looking for.
Qi
Qi
stagnation.
stagnation locally over
Oh.
there, right? Yes. So what causing heat? What causing heat?
Well, when qi stagnates, it can create
Yes,
heat.
exactly.
Yeah.
So excess of the qi stuck there causing the heat, right?
Yeah.
What causing dampness retention? Qi does not flow stuck over there,
Yeah.
causing the dampness around there.
Yeah.
So which means if you can circulating the qi over there, both the dampness, both the heat
Yeah.
will getting reduced, right?
Yeah, yeah.
So which means you can reduce the symptom 100%. And our next step is to find out why there is a qi stagnation only to there. This is treating the root, right?
Yeah.
So treating the symptom actually is quite easy. You just to the maximum level you circulate the qi to the shoulder region, and I guarantee you the result will be phenomenal for temporarily though.
Yeah, yeah.
Okay, yes. But next step is you have to find out what causing the qi stagnation over there. To answer the first question, how can we maximally circulate the qi locally over there? Is you have to study. We have dampness, we have heat there. So what can get rid of the heat? What
Yeah.
can get rid of the dampness? For dampness, we just mentioned you have to do a lot of warm up,
Yeah.
and for the heat, you have to do strong stimulation.
Strong stimulation.
Yes, strong stimulation. You have to get rid of everything.
Yeah.
Today I showed May some technique chicken feet. That is the
Oh,
I
yeah,
think,
yeah. 1, 2, 3.
Yes.
Yeah, yeah.
Not only 1, 2, 3, you can go multiple directions.
yeah.
So 1, 2, 3 is just a metaphor for the chicken
yeah,
feet,
yeah.
right? You can go multiple directions going like this.
Uh-huh.
This is using less needle cover the bigger region of
Yeah.
the part, right? For that one, imagine what happened to underneath of the skin. You are using needles to poking several holes around here. When you withdraw the needle, what happened to that hole when the hole is not fully sealed? There will be body fluid and the blood or qi gonna go
Yeah.
inside there, right? It's like you poking some hole, allowing more qi and blood to going underneath around
Yeah,
there,
yeah.
right? So actually you increase the blood flow and the qi flow underneath around there, right? So this is why we're using the chicken feet around here. Imagine you only leave the needle around here. You didn't increase any of the qi of the, maybe to the qi level,
Yeah, yeah.
making the qi stronger and the blood overall will flow. However, when you go in this is the obviously way stronger than this one, right? Yeah. So which means in the future when you want to increase the qi blood flow, chicken feet will be very good one. Yes. Plus some warm up before, so the result will be very good. So this is treating the symptom. However, when you want to treat the root, you have to find out what causing the qi stagnation only to that part of the gallbladder channel. Right?
Yeah, yeah.
So actually, according to the tongue reading, there is still some type of T4 from C7 all the way to T4, T5ish. There is a slightly deviation of the spine over there, so causing actual force to this side of the body and causing a lot of pressure over there, causing more qi stagnation over there. maybe she's have some like an emotional issue or some liver spleen related issue causing dampness retention for the gallbladder and the liver organ itself, right? So causing the dampness around here. So maybe it's a combination of both, right? So for one, you have to target the organ, remove the dampness for the organ of the gallbladder and the liver. And for two, you have to work for the channel, making sure the dumoulin gallbladder channel both have enough flow over there to prevent the future stagnation of the qi over there, right? Yeah. Then this is targeting the root.
Right. But her problem would be able to come from emotional problems alone, right? Because emotional problems would cause it everywhere.
Exactly. Yes.
Yeah.
So
that's why. Is that why you're saying it's T4 T5?
Yes.
Because
yes.
more specific.
Exactly. Yeah. So our TCM, if you really want to solve one thing permanently, you have to find the cause for both the symptom and the root to have the full diagnosis of this patient, and then will be a great session. And actually, I really want you guys to go this approach and share this diagnosis, all the information you happening in your mind, and share with the patient. When the patient have a deeper understanding what causing those, the patient likely to come back more often, have more treatments, and it's better to have more permanent result. We're not only looking for our business, we're looking for the patient's own health as well, right? If you do not do this part, patients say, oh, I have a temporary relief for about 2-3 weeks already, so I don't have to come back more. Maybe after a few months, this issue will reappear, right? So this is not a full treatment from the TCM approach. So that's why we share the treatment plan.
I see.
Yeah. Any other question? All good, right? Yes. So when there is nothing more, I'll share some of your personal things you need to work on. Okay. Yes. So for you, actually, both of you share a little bit the similar issues around here. So you guys a little bit towards the reckless. Okay. You doing everything too fast. You doing all the actions like too fast and didn't have enough mature thoughts like going through your mind first. Yes. So next time when you're treating patients and when you making judgment calls and when you taking certain actions, making sure you do everything slow. So slower approach for you two at least is a safer one. Safer one actually will be a more steady one. Okay, more steady one. Sometimes your treatment feels like a little bit rushed. Okay, a little bit rushed. Yes. So that's one. And two, for me, I know sometimes you mean very good and you have a lot of experience. However, you didn't show enough care for your patients. When you show enough care, the patient can feel it and the patient will trust you more and come back more. And if you have all the care inside of you, but you didn't show them out through within this treatment and the patient cannot feel it, usually you are no different from the next door practitioner. They might choosing other practitioner over you, all right? So you really have to show like you care, okay? Yeah. So you might care, however, you have to show him out. Okay, yeah, that's something. Yeah, you should know of. Yes, and yeah. Yeah. Come on in.
Sorry, I'm sorry.
Oh yes, several things. Yes, the oil is one. Yes, you didn't thinking about the oil temperature, right? Yes, you apply directly on the patients. So if for me, I have a very sensitive skin. If I feel cold and you putting oil directly on my skin without putting warm up from your hands, yeah, so I feel, well, you didn't think through this part. Yes. So for me personally, when I want to doing the oil massage, I go in here, not only that, I will just rub around here for about 20 seconds, warm up everything before I apply that, okay? So at least you didn't reach in this step yet, right? That's one, yes. And two is, well, when I seeing people lying in the treatment bed, my first thought is this person will feel cold or not. This person will feel not covered up like enough or not, right? I check in the temperature of the feet, I check in the temperature of the lower back, and I try to cover as much as you could, right? For some heat patients, I don't have to do so. Depends on your diagnosis. However, for Francis, definitely that is kind of a young deficiency patient, right? So cover up actually is a quite important point, right? So when you're doing certain warm up for the shoulder, so you didn't do anything for the lower back yet. For that moment, I will definitely cover up the lower back instead of expose everything for the whole back, right? So all little details, yes. So you really have to care enough. So when you care enough, the patient will kidding themselves to go to your clinic, okay? I can guarantee that because you're treating them as your own friends, as your own family members. Every people want to find the practitioner like this, right? So you have to be like this, okay? Yes. And for Matthew, right? Yes.
Tom.
Tom.
Matthew's
yes.
my brother.
Oh, Matthew's brother. Okay, good guess for me then. Yes. So for you is you didn't have a very good needle selection, like a point of view. Yeah. So before you apply the needles, you really have to think what size of needle, how long is the needle, what direction of the needle I might use during my treatment. Then choose the right needle accordingly, right? For example, for you, I know you want to doing some like electronic needles.
Yeah.
You want to longer handles around there, right?
Yeah.
However, for that case, I would rather using 1/3 needle instead of 2/3 needle, because for the 2/3 needle, you only getting half, like a 1/3 in, and you leave a big partial of the needle outside, right?
Yeah.
So this one actually wiggles a little bit, and especially for the jumping of the needle, because you hook up the electronic machine, right? When it's drop like a jumping like this, and you are not in the room, high chance the needle gonna bounce out, without notice. So you need a little bit deeper insertion with a shorter handle of the needle, right?
Yeah.
That's the one, yeah. And two is when you know you're not aiming for the full insertion of the needle, I would rather using a shorter needle for the full insertion instead of a longer needle for half insertion. Yes, it's much better this way, better for the dirty sensation and better for look. Yes, that's two. And three is for the yang deficiency or qi deficiency patients, I rather to after I apply the needles, I know I'm gonna put a lamp on top, but sometimes when you get in the lamp too close to the patient to feel burn, right? Too hot. When you getting too far away, so the center is okay. However, the lateral side of the body, the heat is not that high, right? This you feel cold. So for me, I rather to cover up of the patient. So I choose the needle go transversely or obliquely instead of go perpendicular. Right?
And then you just cover with towel?
Exactly, yeah. Cover with towel, cover with paper, cover with something else. At least we can do so, right? If you go perpendicular insertion, especially for the whole back, so there is not much room for us to cover everything, right? Even you put a lamp, but the lamp will not cover the heat evenly for the whole body, right? Yes. So this is something you might consider for the future treatment, right? Yes. Okay. So you can go for the longer needle, but at least go oblique insertion, you can go deeper, and then you can put something right on top.
Okay.
Yes. Okay. Good. All right, so hopefully I didn't get you guys mad, all right? Yes, because this is my job, okay, to point out what I think there's a room for improvement. You guys can be better in the future, right? Yes, because I care, okay? Yeah. All right, so.